everyone, and welcome to the presentation on Health Informatics. This is one of our brand new concentrations, and I'm here to tell you all about it. I am Prashanthi Manda, and I am the director of the Informatics and Analytics concentration. I'm also one of the designers of the Health Informatics concentration. So I really strongly believe in this concentration and think it is an awesome direction for those of you who are interested in making an impact in healthcare using your data skills. Okay, so let's launch into it. The first thing to think about is why should we care about health informatics, right? When we think about healthcare, we think about people that help the patients the most as doctors and nurses, and that's still largely true. However, in this data-driven age, when most of the data we provide to doctors and clinics, when all of that resides in an electronic format online somewhere, the potential starts to shift a little bit to external parties outside of the hospital. So when we think about a doctor making decisions about patient care, that doctor can look at data for a limited number of patients. However, if you have the capacity to put together patient data across the whole county, across the whole state, now you have the potential for learning new things from that data, learning new patterns from that data, and driving policy decisions, all in an effort to improve healthcare, right? So the global health informatics market is expected to reach 20 to 60 billion by 2026. That is a huge cap, and a large portion of that market is not tapped right now just because we don't have enough people with skills and training in health informatics. We already know that in healthcare, algorithms that are powered by AI are already doing a lot better than humans in certain tasks, such as looking at x-rays and mammograms, for example, and finding anomalies. So before I go a little more forward, I want to take a step back and tell you what health informatics is. Okay, so in the area of health informatics, the primary goal is to look at data pertaining to patients. This data can come from electronic health records. Electronic health records are the database of all of the data that the hospital keeps on you. So when you go to the hospital, a nurse comes and takes your height and your weight and your blood pressure and puts that into a database. Then the physician sees you and puts information in the database about what symptoms you're experiencing, what the diagnosis is that you're being given, what medications you're being prescribed, and so on, right? So all of that is healthcare data. If we can analyze that healthcare data, apply visualization or predictive analytics or any of the tools that you learned in your core courses, and if we can come up with solutions to solve patient problems, and I know I'm speaking very vaguely here, and that's because the field is so wide and open. So if we can do that, that essentially is health informatics. So think of it as using all of the data skills that you learned in your core courses, applying it to healthcare data to eventually improve patient care. So what's achievable here is improved patient care, okay, enhanced public health, and making health systems more efficient, right? And hopefully when health systems get more efficient, that savings and those cost savings hopefully trickle down to a patient. Now, all of that is nice, but to give you a little more perspective on why this is a hot and happening and in demand field, I went online and I said, what jobs do I have available within, I think, 60 miles of where we are. I think that's what my filter was, for people who are trained in health informatics, and this is what I found. Okay, and the jobs go on and on and on, which then tells me that if in Greensboro, a relatively smallish town, 60 miles of Greensboro, if there are so many opportunities for people in health informatics, just think about the potential in across the country, right? So, for example, this position here is in the Wake Forest Baptist Hospital at Winston-Salem. This is a position for clinical data analyst. So you would be analyzing data from their EHR systems, clinical data, and if you look at the qualifications, all of you would be absolutely qualified for this job once you get through the concentration. The other job here I'm looking at here is database programmer analyst, again for a learning health system at same Wake Forest Hospital. So if you see, the same hospital has multiple openings for people with these skills. Moving on, here healthcare data analyst, and this is a fully remote job. You can see here that the salary range for this job is 92 to 96,000 a year, and in fact, if you ask me, I think that's on the lower side for jobs in this domain. So you can absolutely get more than that. This right here, it's information technology data analyst for a healthcare company in Durham. Healthcare data analytics analyst. So here, this is exactly what you're learning to do. Okay, let's read through these responsibilities and you'll see that you all would be qualified for this job. Develop and apply data analytics methods and tools to improve decision making processes. You've learned a lot about this in 604. Analyze and interpret healthcare data. This is exactly what 630, the first course in the health informatics concentration, teaches you. Develop models to forecast trends within the healthcare industry. We talk about this in the second course for the health informatics concentration, which is AI in healthcare. And so on, right? So what I'm trying to tell you here, the point I'm trying to make is that one, this is an up and coming field. Even within data science, so even within the field of data science, data analytics, which is again a hot field, even within that, health informatics is shooting up at a rate that nobody really expected or predicted. The good news here is that you are beginning to find a lot of people who are trained to be data scientists, but you again have a shortage of people. A small percentage of those people are actually qualified to be health analysts, because healthcare data is very different from regular data because of several aspects that imply privacy and confidentiality. It requires you to actually have a good amount of domain expertise. So to be a healthcare data analyst, you actually want to have training in something very specifically designed for healthcare, which is the health informatics concentration. So in this concentration, you have 3 courses, and you will take these 3 courses after you've taken all of your core courses. The first course is IAH 630. This is Fundamentals of Health Informatics. Like I said a little earlier, there are a lot of nuances and peculiarities to healthcare data, which you should absolutely know. So in this class, we will talk to you about what health informatics is and what some standards are in the health industry, how electronic health records came into existence, what an electronic health record is, what are some of the factors that decide how the data can be used or how it should not be used. We are going to talk about health information infrastructure and learning health systems, all of the different kinds of systems that house data within hospitals. We're also going to talk to you about public health informatics. Okay, what is it and how is it different from regular health informatics? By the end of this course, you will have a good understanding of the history behind how healthcare data became electronic. You will understand different perspectives of what to do with the data, what not to do with the data, all the different kinds of data you will see in this field, and so on. That will prep you to go into the second course, which is IAH 631, Artificial Intelligence in Healthcare. So now that you know the different kinds of data that exists in healthcare, this is the meat of the concentration, and this is where you're going to learn exactly. We're going to go over some basics of data science. We will then look at, well, if you have all of this healthcare data, what exactly can you do with it? What are the kinds of things you can learn from it? Okay, so we will talk about applying machine learning and predictive models to that healthcare data. We are going to introduce specific patient outcomes, and we'll talk about different models to achieve those outcomes, and so on. We here in this class, you will learn about working with structured data, which is, your clinical data, your labs, your weights, your weight, all of those things. But you will also learn to deal with unstructured data using text mining and natural language processing tools. One of the things, as you think about machine learning is often thought of as a black box, as in you give it some input and it does some processing, and it gives you a result or a prediction, and you don't know how that input got transformed into that output, right? That is fine for some domains, but for healthcare, it absolutely is inadequate. And that is because you cannot convince a physician to trust a model when the physician does not know how the model is making its decisions, right? So we will talk about explainable AI. Explainable AI is extremely important in today's day and age. It is driving a lot of the conversation in AI. So we will talk about how exactly do you get the model to explain its decision-making process, so we have greater insight into the model's decision-making, and it's transparent. We'll talk about that. And finally, we will wrap up this course with a discussion of future of AI in healthcare. The last course will talk about ethics and intellectual property concerns when it comes to healthcare data. So when you are looking at patient data, when you're working with patient data, of course there are limitations on what is ethical to do and what is not ethical to do. So here we will talk about algorithmic and AI accountability and transparency. We will again go over some HIPAA compliance rules and regulations. We will talk about when you work with data pertaining to patients, what are some of the data use agreements, how do you remain compliant to the data use agreement, and finally we will talk about concerns with surveillance and privacy of patients. UNCG is extremely well positioned to offer this concentration for the following reasons. When you work with healthcare data, having access to that data, first of all, is going to be a huge limiting factor. However, UNCG is one of the 5 universities across the country to have a Medicaid database, data from the Medicaid database in-house. We are actually working, the Office of Research is working on setting up the data that we got from the state. We have close to 1.2 billion claims. Just think about all the interesting things you can do with that data set. So we are in the process of setting that up so students and faculty across UNCG can access that data and create projects and get their hands on that data to look at fun outcomes. We have worked a lot with Mimic, which is an open access healthcare data set. A lot of my students have done capstone projects and theses based on that data. We have an ongoing partnership with Cone Health. One of my research areas is Health Informatics, and I have for the past 6 years collaborated with people in the nursing department here at UNCG, as well as people from Cone Health, to look at patient data and work on specific use cases. So we have that partnership that we can leverage. And finally, I'm very proud to say that one of our health informatics courses, which is the second one, IAH 631, is actually taught by an industry professional. We recruited the director of artificial intelligence at United Healthcare, which is an insurance company, to teach that course for us last semester, and hopefully we will be able to get him back to teach the same course the next semester. So this really gives you access to a leading expert in the industry, and you get to learn from one of the best, and you get to have a fresh perspective from somebody who's actually working with all of this kind of data and dealing with real world issues on a daily basis. I hope that helps, and I hope you got a good understanding of what the health informatics concentration is all about. I'm happy to take questions after this, and I'll see you in a little bit. Thank you.